Please be aware that other folks may be able to see you and to take care not to screen share your computer. Anything that you broadcast may be captured in recording. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless otherwise noted. We are now turning to the first item on the agenda. Before we do play, so please permit me to cover some ground rules, effective and clear conduct of our business. I'm sorry, I think I maybe was supposed to read this after I called the meeting to order.
It doesn't matter, just go,
Okay,
honestly.
thank you.
I think it's the gist and you said the basics. I say just jump and go to the agenda.
Okay,
Sorry.
thanks. So I'm gonna call the meeting. Thank you. I'm calling the meeting to order. So I did that a little late. Can I get an approval of the agenda?
So moved.
Okay, first thing on our agenda is the review of the third quarter reports. Does anybody have anything to say about the reports that were sent to them?
You need to take a vote, don't you, on the motion?
Oh, sorry, right. Can I have a motion to
Do a roll
accept?
call.
I second. I second.
Thank you. Bert Johnson,
Aye.
Jill Veith,
Aye.
Brooke Moore,
Aye.
Dorothy, aye. Sorry, guys. I'm trying to get this all done in 10 minutes. So are there any questions on the third quarter reports?
Dorothy, I have just one
Mhm.
couple of quick comments on the NFFRA one. I just think it's interesting to note that their revenues are greatly exceed their budget for 2021. And I just wanted to make note of that they had income of $1,099,000 with a budget of 685 and expenses of 675. Budgeted expenses of 675, 100,000, 670. You know what I'm saying?
Yeah.
An actual of 738. So they're in really strong financial position is the point I want to make. And then the other thing that concerned me is one of the reports they sent had client names on it.
Yes.
Oh,
Yes,
Okay.
there is that. I'm noting on that one, I noticed some discrepancies in some of the numbers again, in how they were calculated. So yes, thank you for noticing that. And I did notice that. I would sort of like them to go back over some of their numbers in presenting to us, and we will reach out to them about the public documents. We've talked to them before about putting names in public documents, but we will send a reminder on that, Brooke.
Yep. And I think that with this year's contract, if we can request a more simplified financial document from them and maybe from everybody in terms of reporting it's 21 pages of I don't think we need every, well, I mean, obviously if there's addition discrepancies, but it's very hard to follow their
Well,
financial documents.
I think that it can be done and made easier. I think that one is extremely hard to follow because it doesn't make sense when you go across lines at all in how they've done it. And they're actually too big to be doing in that format that they're doing it in. So it doesn't work.
Yep.
I think that we need to discuss that a little. Yeah, we don't have much time.
Right. I don't think we need to discuss it. I just wanted to make note. For the record.
The other one that I saw, I don't know about anybody else, I found it interesting that Cape Mediation, even though they submitted their bill, has actually not served anybody this year yet. So because of COVID, but we're still paying for services that we're not really getting any benefit from the services.
Well, I've had some cases by Zoom and so forth at the court.
Well, according to them, they did 0.
Oh, okay.
Okay. So I'm just putting that out there. I just would like to keep an eye on it. I guess that's what I'm saying. I'd like to keep an eye on that one. Otherwise,
I think we can pay if they haven't provided services. So I'll talk with Ann and Jericho about that. We can't just pay.
So the problem was that in that contract, and this is what came up last time, Rachel, if you and Jericho and Ann can look at it, is that it says that we pay for the executive officer's position as well.
Not necessarily if that's not how the contract's written, so I have to look at it.
Okay, thank you. Would you? I appreciate that. Okay, are there any other questions in regards to the quarterly reports? Comments? So with, can we get, do we have to make an approval of these? Yes. With, no, can we get an approval on the quarterly reports with Rachel taking a look, Rachel, Jericho, and Ann looking at Cape Mediations?
So moved.
Okay, do I get a second?
Second.
Okay, Bert,
Aye.
Jill,
Aye.
Brooke?
Aye.
Okay, Dorothy, aye. Okay, the next one is, everybody got the notification from the Fairwinds request to modify the 2021 and 2022 grant funding. I'm gonna make a statement on this, and then I'm actually gonna recluse myself, guys.
And we don't have a quorum.
uh, Okay, well, I think I have to let you know how I'm feeling. And
Just close. I think you can do it. Just make your statement and just do what you're gonna do, and I think you can still vote with the caveat that you're gonna say what you're gonna say.
Okay, so I'm gonna have what I have to say, and then I will vote then. I believe that this has to be a business move on Fair Winds. It is not a responsibility of the town in regards to the funding of the services when patients do not show up. I do not want to go into further discussion because I have had discussions with prior discussions in regards to this with clientele with them in the past. And that's why I'm not going to go further into discussion. I'm just letting you know my opinion. I believe it should be a business matter and not a matter of town to support when people do not show up for their meetings. And then
Was there documentation in our packet on this, of the request?
Yes, you got a notification from Ann, and on that, I'm also going to turn this over to Bert Johnson. I'm going to let Bert sort of run the show, guys, so he can. Okay. Okay, Bert, I'm handing it over to you.
Okay. Do we have any discussion on this issue of their request to modify their agreement?
I'm sorry, I think I just don't understand it well enough, and forgive me that I don't.
May I very briefly outline it as explained by Michael Kellerman?
Please.
So very, very briefly, they were noticing that they had a steep drop off in returning customers once they applied the cancellation fee. Michael explained the intricacies of why they have a cancellation fee because of the nature of getting someone out here to do the counseling. And they believe that if they waive the cancellation fee, they'll have an increase follow through from people who have not moved forward because they were penalized for not going to their first meeting. I do think Dorothy makes a strong point that I had not initially thought of with this, is that town funding will be going to not treating people. But I am very curious to see if they do see an increase in persistence from treatment. I know that they have a steep drop off. And then I also asked Michael to kind of dig up some data about the number of cancellations, and then potentially seeing if it changes if this does go into effect.
So it's really just something. It's really something that they just want to try. I mean, how steep is the cancellation fee?
I think it was 75.
Experiencing a roughly 60 no call or no shows per quarter. Not all of them are sliding scale fee. So this would only be to pay for a cap, because that was one thing I was concerned of, is do you have somebody who doesn't show for 7 times and we're paying the $65 fee 7 times and continuing to keep them in the schedule, to Dorothy's point, then you're not moving on to the wait list for somebody who's eager to get in. So they had mentioned doing it a cap and only paying for the amount that is for the clinician, which is 50. I believe their total fee is 65. So I think their thinking was, if they're on a sliding scale fee and they already can't really pay, and now they're assessing a fee for when they don't show, it's a further deterrent for them to continue the treatment, because then they know they owe a balance before they can get in. But again, to Dorothy's point, then we're ultimately paying for a substantial amount of the funding that we just happened to give them their full funding this year, where other years it's been limited. Because this is for this contract, the remainder of this contract, as well as the upcoming contract, for services that aren't even rendered. And so there comes a point where, when is this just a agency level responsibility of how to manage the no-shows, versus deterrent of care? So I think this,
Well, I've got another question. So if somebody's on sliding scale doesn't show, then do they get somebody who's not on sliding scale to come in, like you said, this wait list?
I think it depends on whoever's next on the wait list. They could be sliding scale, they could be insured, they could be private. I don't think they then get sliding scale to sliding scale. They don't go payer source to payer source.
Can
Well,
we have a cancellation fee like with a cap, meaning not just the amount, but maybe there's an overall cap per quarter? Like, we'll only pay so many hundreds of dollars for that, like kind of have a contract with them in that way?
I think should this body decide not to accept this, I could go back to Michael at Fairwinds and see if we could word it as a trial, perhaps. Maybe they do this for X amount of time, see if there's an increase in people continuing treatment, and then
Yeah.
come back to it for next one. I don't know if that's a feasible thing here.
Well, based on their request, the language that's added into the contract is, quote, "It may also provide for coverage for clinician costs up to a max of 2 incidents at a maximum of $50 per incident of a late cancellation no-show for an individual sliding fee service." So there already is built into the request an allowance for only $100 per sliding scale individual for the period of the contract,
But that's per person.
per person.
And how
So-
many people are on the sliding scale system that we cover for? Do we
We don't.
know?
Just gave us an average of 60 per quarter. So that's a very significant amount of people if you add that out. over the-
Yeah,
So if you want, instead, you could go back and say, we will only approve a max of
$1,000 or
$50
something.
per incident for $1,000 for the entire contract period. That's however, whatever cap is something that you would like to do. And then you could also, like Jericho said, this now adds a section into their quarterly report to say number of sessions applied to the grant and number of clients who it was applied for. So you could also ask them how many people really this impacted, but then maybe also ask for the follow-up of did you see an increase in people attending or not? And if there seems to be no benefit to us paying for this, then maybe that's where you would review it at a later date.
I have
I
a
mean, that,
question here.
sorry.
I have a question. What are they doing? Dentists and doctors send you an email, or they even have their staff call you the day before to remind you you have an appointment, and they also may call you or send you an email on the morning of your appointment. Are these people at Fairwinds doing anything like that?
I did not get follow-up information based on that, but one of my questions was that this does seem to be a agency level need to do that follow-up or reminding. I don't know exactly what their process is.
I have another question. Is this doctor new?
It's just whatever clinician the sliding scale fee person was going to see. So it could be, yes.
So these people are seeing someone different every time?
It depends on whoever they're assigned to, Jill. I don't know what their clinical treatment plan is. They could be seeing a therapist that's just a regular social worker therapist on island. They could be seeing a psychiatric doctor. There's no indication of one type of treatment versus the other.
Yeah, but I thought the whole point of this was that we're paying for this expensive licensed psychiatrist. And you're
One-
saying that people aren't showing up to see him or her, whoever that is.
That's one part of the contract. This is just people not showing up this is for the sliding scale services. So that could be a specialized clinician, but it could also be a clinician on staff. There's no,
Oh, okay. Okay.
We gotta talk to Brooke. Are you still with us, Brooke?
Yeah,
And-
yeah, I have to go, but I'm gonna make a recommendation that we approve something like this with a financial cap for the remainder of this contract and ask them to come back to us in June with some results of the change to see if they have anything to report before we amend the next year's contract.
And
I
may
agree.
add
That would be
something
my recommendation. And
that
then I gotta run.
That they show us what they're doing. Are they calling people? Are they emailing people ahead of time and whatnot?
I will happily investigate their process a little bit later today, but I think that I can see an effective, if this does have more people going to more schedules, then I think the potential for us to be paying for not services might be ameliorated to a certain extent. I very much like, well, I very much understand Dorothy's point here that we're paying for not stuff to a certain extent. But if we can increase the number of people who go to their second, third, or fourth, therapy session, then I think the potential there might balance out. But if I had a personal recommendation on this, then I would suggest that we trial it for a short period of time. If it does have a positive impact on the number of people not canceling or maintaining more therapy sessions, then I think that the cost there may be worth it. My personal interaction with these kinds of things is that there is a ton of cancellations, especially right at the beginning of any kind of therapy process. So incentivizing people or disincentivizing people from going to a second meeting because they miss it, or because they freak out, or because they don't think they need it, or whatever else. I think we should limit that as much as possible, while not throwing money at nothing or covering administrative costs.
I'm going to make a comment, but not just a comment. In the clinical world, most theory is when somebody is committed, they show up, even if they have to pay $5 for that meeting. When people don't have money, they make you pay $5 to walk in the door, because that means you're committed to your therapeutic sessions. And I think we have to look at it as, is there a reason they're not showing back up? And that I think is in the broader spectrum of Fairwinds having to figure that out. And when we start talking about us covering cost, or the town covering cost for them not coming because of cancellation fees, why are so many people canceling? That's an astronomical amount of number for people in such need for therapeutic services to be canceling. And what in-house is causing that to happen? And when we look at that and we look at services, what other organization did we not give money to that was providing services that funding could go to for services? So,
Well, that's a good point. Do we do this for anyone else? Excellent point, Dorothy.
and I guess what in trying to be very limited, I just want to make sure that we're looking at it as, we always ask everybody else to cover their business and cover it right. And we don't pay them for when the business isn't working right for them. And so what's, like Bert said, what do they have in place to make sure that their clients are coming, and what do they do? And I just don't want to see us set precedent that this is an okay thing, and that we're funding something that should be fixed in-house first, that there should be an effort in-house first to fix it. And always going, it seems like we have a lot of organizations, and I don't mean this like meanly, that come and think the town can fund this to fix it. And this funding is actually like really a gift to try to keep these programs running, not a Band-Aid when something's not working. So that, I just want to, if you know therapeutic, and you know enough about therapy, there's always a good therapist tells you, even if it's $5, you need to show up and give me that $5 because you're committed to this. And why aren't they showing up, guys? That should be a question.
I agree wholeheartedly with a lot of what Dorothy said right there. And I think that we're in a unique place where we can not rely on theory. We can do an experiment and see if this is one of the things that will help them retain customers. But I think that Dorothy is absolutely right. We should be asking them what else can they be doing to improve attendance, basically. I can see both sides on this one. I am always the kind of person who wants to at least try and test something if that's at all possible. And I think we could maybe go back to Michael and mention that we might want to try and have him reword his request a little bit and either bring it back or not after that. I really very much see Dorothy's point on this, but I also am curious to do an experiment with a limited set to figure out if it actually will change things.
Well,
Yeah, I like that.
go back to him, find out what they're doing. If doctors and dentists are doing something, they don't do it because they're losing money at it. They're doing it because they're making money at it. So they should be going into a program like the doctors and the dentists use to call people, send them an email a day or two before, once at the beginning of the week, whatever. Emails are so easy for someone in the office to do. And just like we did this morning, when we didn't have enough people, we got on the phone and called people or we emailed them.
Jill, that was you.
I'm sorry, guys. I'm usually on. I'm sorry. They
Well,
I think that my
You're a
question
good
is,
example, Jill.
I think my yeah, I feel good about that. If they're telling you, by the way, that they have a wait list, right? Then they're not losing money. So, if they don't have a wait list, then they're losing money, a wait list that's being fulfilled. So I think, right there.
Would it be better that we defer a decision today and I can investigate more and share information with you guys? Is that a better approach?
Well, we have to now because we don't have enough people to vote.
Okay.
So then,
Okay.
I'm sorry, Rachel, please go ahead.
Well, you have 2 months left of a contract, so deferring a decision is sort of not going to do much for this year's contract. So it seems to me what you're doing is asking for more information on their process, and somebody would take a motion to do nothing with this year's contract and ask them to do something related to next year's contract. Because if you get,
we have to pay it this year.
if you get the information back and they say, yes, we're calling, we're following up, we're reminding, we're sending texts, we're doing all this, if they are, they could say they're not, then how is that going to change your decision whether you fund or not? And then are you meeting right away to approve something for basically 2 months left in the quarter? So timing wise, you might be looking at saying, we want more information on this. We would only support a cap and only for the next contract. But you will have to meet again then.
You make that sound like it's horrible, but
It's not. Just saying, if you just go back and ask for more information, then you're going to have to regroup to make a motion. So
I think we need more information.
So then I'm going to ask about their other processes for retaining people. And then is there any other direct questions you'd like me to ask on this particular topic?
Have they investigated calling people a week ahead of time like doctors and dentists do? Have they sent emails a week before or a day before reminding people of their appointment? And a lot of times in that email, they'll ask you, are you going to be here? Yes or no? If you have to cancel, then they know at the beginning of the week that you suddenly now won't be there for the meeting, so they can schedule someone else into that time if they have a waiting list.
They also
Do you
have
want me to
text.
see if I can get Michael on the phone right now to answer that question rather than deferring a meeting?
Sure, Rachel,
Yeah.
go ahead.
He might not answer, but let me
Okay.
try.
Yeah, go ahead. Bert, I would also suggest that Dr. Roberts' office sends you like 3 text messages and you have to confirm I'm coming.
Yeah, Leprey's office does the same thing, and the dentist's office does a similar thing.
I mean, again, my thing is if they have a wait list, they're not losing money. So I don't know if they're chasing people or not, but I just think if they are able to fill the spot that day, they haven't lost money that day.
But
So
the only way they can fill the spot is if they know ahead of time. You know, they can't halfway into an hour call someone and say, can you come in right now?
Yeah, but they might get them later that day, or they might get them sometime that week, and they might make up their hours for the week, right? They probably, in their business model, I assume they have so many hours a week of that they need to bill. And if it all averages out at the end of the week, then it seems like it's not unrealistic to say, hey, you're meeting what your needs are.
hey, Bert,
Yep.
can I ask you, while Rachel's trying to is talking and trying to get the call across, if there was any, do I see that people are saying that maybe for the next fiscal year that there's going to be they'd like to see a cap on the amount of money paid?
I'm hitting video. Okay. I have Michael on speaker, so I'm hoping this will work okay. So I sort
Thank
of
you.
just briefed him quickly. If any of you want to ask the question to see if that can get relayed properly.
And can you all hear me?
Hi, Michael. Yeah, we can. I'm going to let Bert Johnson's going to ask you.
Yes, we had some questions on what's your practice about reminding people of appointments? Do you send out an email or phone call a week ahead of time or a day ahead of time or anything like that?
Absolutely. So let's assume we're talking about a client for whom we have phone contact, email contact, and text contact, because those are the 3 main ways that we, try and keep in contact. There might be a client who prefers not getting an email or doesn't provide an email or, wishes not to be connected. But for this answer, I'll assume that we have multiple ways of contacting the client that has been granted permission for. And
Rachel, he's coming in and out. Sorry,
am I going in and out?
you were, but I think you're a little better right now. Thank you, Rachel.
Sure. So I was just going to remind the group that we did recently add text messaging as a way to fully communicate with our administrative and front desk team, which younger people are actually using to set up appointments and cancel appointments, et cetera, on a regular basis. So the answer is yes. There are multiple ways that we work with clients to remind them of appointments. That happens at the setting of the appointment, where once the appointment is set and agreed upon, there's a reminder that's sent out. A reminder is sent out in close proximity to the actual date of the appointment. There are phone calls that are made, phone calls or emails that are made immediately if there is a no-show for an appointment. The clinician who is seeing that will be the first person to reach out to the client to say, hey, we had a meeting today at 2, just making sure if you need to be a little bit late on here. And then they communicate if they hear from the client, and our front desk administrative team then immediately follows up to find a way to either discuss the consequences of missing an appointment or to set the next appointment or to understand why the appointment was missed. So I could map out pretty clearly in writing if you need to what the multiple steps are there. But in short, there's a lot of communication to try and increase connectivity to those appointments. And if there's a missed appointment, there are multiple steps taken first by the clinician. The best result is that, I've been in this position myself as a person where it's like, oh man, you're right, it was 2 o'clock today. I'm late, but I could jump on, or oops, I missed it, whatever it might be. It starts with the clinician and then punts back to our front desk administrative team who provide the support at the beginning and at the end of any process.
And then what was the second question?
Did somebody, I mean, I'm not supposed to be running this. Did somebody ask a question on caps?
Why don't you reiterate it, Dorothy?
Do you,
Oh, sorry, I think it was the wait list. Jill had asked that. If
Wait.
somebody show for a certain amount of time, do you move onto the wait list, or how long do you, sorry, I remembered. Sorry.
So the answer is yes. We do operate currently on what's called an active wait list, which means that we are doing two things. One, we if there's a wait that's any longer than a couple of weeks to get in to see Dr. Maxwell or to get in to see a certain clinician or a certain line of service, we will schedule people in advance. So at least we're taking that effort to schedule them, even if it's 2 weeks or 3 weeks into the future. That's one side of the active wait list, but I think the more pertinent answer to your question is, if we have a no-show, do we work to fill that 45 minutes with an additional person? And the answer is yes and no. So we do have, if you recall, the urgent behavioral health clinic. And if we know in advance that someone canceled, and or if we have that open spot, which is Monday through Friday, 5 to 6 p.m., and typically runs at about 50% utilization. So think about it, that's the most likely open spot that someone could be put in. We do actively assign people on a waiting list or who are already waiting on their appointment that's scheduled into the future. We do move people into those spots. So we do much like your dentist might do in saying, hey, I'll put you on the wait list. Then they call you that day and say, I have an opening at 1. What we can't do, however, which is a difficulty for us, is if it's already 2:08 p.m., the clinician's reached out to the client, the front desk has reached out to the client, and it's clear that either they missed the appointment or that they, had an excuse and were able to schedule the next one. We don't have enough time to be able to then make contact with someone on a wait list who could use that appointment and slot them in at that same time. That's why it's so problematic in the field with no-shows. A lot of agencies come up with sort of fancy algorithms, I think the word is, to come up with ways to anticipate how many people might not show and what to do about that. And then like airlines, you double book people and whatnot. We're too small to be able to do that. If we had a clinical team of 20 people, we might do that. But unfortunately, there's just not enough time for us to use that hour or that 45-minute period that's unused if we find out in the first 10 minutes that the person doesn't show, which is why it's important that we do the reminders in advance, a day in advance of the appointment, like the regular reminders that we now can use text message to do are the best way to assure that that person either tells us they can't make it in advance or and is able to reschedule, and hopefully will reduce over time our number of people that don't actually show for the hour. But to answer your question, no, we are not able to get another person into that 45-minute session in most instances because we simply don't have enough time in the moment to get in touch with that person and then put them into that session so that that clinician can make their next hour session, which comes up pretty quickly. Does that answer your question?
Yeah, I guess my bigger question on that is if you're making your hours for the whole week though, are you really losing any money? I'm just being direct, Michael, so sorry. If you can add in an extra person the next day or the next week, over the course of the week or the month, if you're making your hours, are you losing money? And I guess I'm just asking, are you losing money because of these cancellations?
So we won't get reimbursed from any source for that any insurance source, et cetera, for that missed session because we aren't for services, right? So and again, I don't want to get too tricky. I'd have to go back to the letter because we worked hard 24 hours cancel your appointment. This is sort of the version we're working on from Fairwind to continue to provide that accountability and to hope that we can get greater, sort of greater treatment ability for folks that have many things in their lives that might be leading them to no-shows or to cancellations of these types of things. So we still want there to be that accountability, but I'm trying to remain focused on your question, which is, are we truly losing money based on the rate of no-shows? Is that correct?
Yes.
So the thing that doesn't stop is we still pay the clinician. We're still, so it's in our best financial interest for there to be as few no-shows as possible and as robust clinical schedules. So, and there are other, certainly in the for-profit space, and I should say in other nonprofit spaces, there are other clinics. We know this because we often get people applying to work at Fairwind who struggle with this, who don't get paid for their no-shows. And it's incumbent upon the clinician to really, or the responsibility lies often with the clinician to through their connection and through their communication, ensure that that person shows up. And so there can be a financial detriment to having no-shows. But at Fairwind, our history has been that we bear the cost of that. We don't pass on that responsibility to the clinician, which is why we built such a robust billing and front desk administrative engine. We take the responsibility for scheduling the client. We take the responsibility when they don't show.
Right. Right. Okay. Thank you.
A comment. So if you have 60 no-shows every quarter, you end up, it basically ends up being $15,600 at $65 a session. You're telling me that you would be losing?
So we lose the gap between the cost of the session, which is in the letter, I believe, mainly the cost of paying the clinician. We're not talking about overhead and other things. And the difference between that number and what we do pass off for the no-show fee. So we do still collect a no-show fee, right? Do we always collect that? No, but we're not asking for that. We're not able to get the no-show fee from the person that's our responsibility. What we're trying to do is lower the barrier to continuing that service. We know that when someone reaches out to us for treatment, needs help, sometimes not showing up to your appointment is part of learning about that person and learning about their struggles and learning about what they need ultimately. And we know that one of the things that happens is when we follow up, hey, you didn't show up to your appointment, we just want to make sure you understand that we're assessing a no-show fee, that fee becomes then the barrier to even continuing. So we do see a lot of times where there's a lot that we write off as no-show fees. By lowering the no-show fee, which we never want to lower to zero, we know that there's a lot of data that show that having accountability, financial accountability is absolutely critical. We're hoping to lower the barrier to not continuing treatment. And it's the difference between the fee that we expect to collect and the cost of the service that we're asking for to be able to include in the write-off, as part of the write-off.
But when you have 60 no-shows a quarter, does that not put a red flag up to you as to why you might have 60 no-shows a quarter?
Oh, absolutely. Now, no-shows are a part of a community clinic.
Yeah.
We were concerned, especially looking back on the data over the first couple of quarters, that we're seeing far more no-shows in a fully remote environment than we were before, right? So that's what leads me to that concern about, okay, these are some of the true costs of human connectivity. Accountability is built when you're in person with someone else, or when you look someone in the eye and you commit to something, or you interact with Celeste at the front desk who says, we can't wait, thanks for turning to us. We'll see you next Tuesday. And we know that there are impacts there. And so when we were talking about what could be leading to more no-shows, two major things popped up. One was process. We had an additional step for people in getting into an intake and scheduling process that we removed. Now it's a more seamless process that was easier in person and was a little bit more onerous. And so it's the difference between calling your dentist and saying, I really need to get an appointment. I know there's not one available for 4 weeks, but can you put me on a wait list? And having them say, yep, you're on the wait list. And us saying, I will call you back and let you know the details of the wait list, right? You may not get that call back. You might not pick it up. You might not, but that breakdown in communication is something that was a normal part of our process in person. And now that we've removed from remote. So our front desk administrative team in the moment sets the intake, sets the appointment, and moves that person into the treatment side of Fairwinds, as opposed to there being an offline conversation about, like who's the right clinician, who has more time now. Like we streamlined all of that so that team can answer that person's request for service by getting them scheduled, right? So that was one of the things that we believe is going to reduce the no-shows, because there were far more no-shows happening at the beginning of treatment than we would like to see. And then when we talked about the process for the no-show fee, I felt strongly that the no-show fee was too high and that it was too much of a barrier. Others agreed, and we started to look at how we might do that. And when we looked at the gap that would create, that would be unfunded, the curiosity we had was, would there be greater flexibility with the town consider including that as a part of our regular grant, not asking for more dollars, but asking for more flexibility to use that, because that may be something that continues to be a concern, and we may have a season where the golf club does a fantastic job of raising money and gives us money for sliding fee scale that offsets that as well. So a little bit about flexibility to use it, and which is why I put very up in front that we were not asking for additional dollars, but more so additional scope to use the existing grant.
So,
And I just want to make one note before you jump back in, Dorothy, and Michael can confirm this. In the letter, I just pulled it up because I had said something a second ago about $50. In the request letter that Michael has that was circulated to the group, it is, and Michael can correct me if I'm wrong, but they're asking for $45 with a max of 2 per client, and they're estimating that's sliding scale fee clients only. Anticipated cost would be $5,000 or less annually.
Yeah, so that's correct, because the no-show fee, or the cost of the service is $65. We're going to lower the no-show fee to $20, which we take responsibility for. The gap of then being $45 that we're asking for support from the town to cover, which would be the true unfunded portion of that, of that, assuming that they pay the $20, and if they don't, that's our responsibility.
Dorothy, do you have something?
Mike, I understand. No, I understand what you're proposing and what you're saying on your gap. I look at it as Fairwinds got fully funded this year, and other organizations did not. And we could be looking at that $5,000 could have gone to another organization that it could have helped fund, where services were actually rendered to somebody. And I don't mean that in a bad way to you guys, but somewhere or another, I think in-house you have to fix something. You have a lot of people not showing up, and you have to fix something in-house. And
if I can respond to that first.
Sure.
I want to underscore, and I would be happy to show data. I don't believe Fairwinds sees rates that are concernably high in comparison to community treatment centers, but I'd be happy to pull some information on that, because it certainly concerns me as a trend, which I associated with being all remote, as opposed to something that I would put as a major ongoing concern. Honestly, some of those incentives I just talked about, where a clinician is responsible and won't get paid if the person doesn't show up, those are the ways that for-profit behavioral health providers reduce their financial risk and make it incumbent on the clinician to do that. that could be something that we'd look at, but I just wanted to just say that it's a natural part of this, but I don't expect that you should be comfortable with that. I expect that we should be constantly pushed to try and reduce the no-show rates as much as possible. And it's in Fairwind's best interest to do that because there is an actual, financial impact to that isn't necessarily covered by other grant funds. But I also want to say it would be totally acceptable. It's the question I'm asking the CRC, and I appreciate this scrutiny because because we're not asking for additional funds, it would be perfectly acceptable, of course, if the answer was, we want to stay within the same scope that we're comfortable with, and you should look elsewhere for the possibility of covering that gap, which, as Rachel just said, is not going to be substantial, but may allow us some more flexibility to draw down the full amount if we're in a different season. And I'm not saying that the golf club gave us a huge chunk of money for sliding fee scale either. The amount that we were awarded in full, which we're very grateful for the next fiscal year, represents the true cost outside of any other costs that we are bearing. So I think to your comment, Dorothy, about hoping that those funds could be used by others, we're not saying we won't need the full $174,000, but we do see this as a potential additional use that could be permitted under it. I'm seeing now, though, how it could be perceived as, oh gosh, they got their full amount and now they're trying to change the parameters. So we would totally accept, and I don't think it would be difficult for us to bear the ongoing costs if the answer was, let's stay within the same scope. But I do feel with integrity that it fits within the general spirit of the sort of gap funding relationship we've had with the town. So that's why we came forth to ask for it. So yeah, in general, I it's something we had to kind of really drill into to even formulate the ask to you guys. So I appreciate the additional scrutiny and hopefully you feel clear about what the ask is, and if you don't, that I'd be happy to take more questions or more impressions.
Well, this is Bert. My concern is the running of a business. I think you guys need to pay more attention to the systems that other people use so they don't have very many no-shows. May well be there's a computer system out there that can be used to, that your clinician just plugs the date, the name and so forth information in, and the computer system automatically reminds them a week before and a day before their appointment, and gives them the option to, gives them the responsibility of confirming that they're going to be there.
Sure. And I take that under advisement. I think it's, again, something that we're consistently working to improve, especially on the systems front, so that we can be more automated than sort of human driven. And I think we want to continue to chip away at that no-show rate. And I think it might be instructive for the CRC to have a conversation at some point about what no-show rates look like, because in the Philadelphia environment, I know that the no-show rates for community health clinics often exceed 20 and 30%. It's the nature of the business. And we've seen those rates actually come down in the remote environment because it's easier for people to log onto their computer or call in on their phone than to actually drive over to Fairwind to make their appointment. But we have seen an uptick in the connectivity of bringing people into the treatment process, which, when you think about it, if your third experience with Fairwind is the assessment of a late fee of $55, that's really what we're calling into question here in this request, more than anything.
Okay, Bert, can I make a proposal?
Sure, Dorothy, go ahead.
Okay. I would say, taking Jericho, taking a little into consideration what you said, that we allot $800 of the fiscal year contract that is still in place, which gives them, because breaking down per month, it's like $416 a month of the $5,000 they're saying. We give them $800 trial money out of the existing contract to do a trial to see if the cancellation policy increases. And we come back to this at the beginning of fiscal year 20, for the next fiscal year, and see if it works, to then agree upon it for next year's contract. Does that make sense to anybody?
No, I think that's an excellent empirical test of whether or not this policy change may have an impact or not. I think when we circle back around it, we should try and determine which particular metrics we want to look at as being significant. But I think that's an incredibly fair way to look at it.
And also pointing out, since we don't have a quorum any longer, we can't really vote on anything today.
Oh,
Well,
I think we can make a recommendation.
Sure. good vote. I think it's. I think
John's
that's,
there now.
I'm on.
Yeah, John's here.
Oh, hi, John.
So you still have four.
Don't we have?
Okay,
a
we
quorum?
do have a.
We do have a
so
quorum,
we
yeah.
can.
Yep.
Hi, John.
I'm sorry to be late.
That's okay.
Glad to have you, John.
Thank you for calling.
should I, is there any more discussion with Michael, or should I let him go and Jericho and I can get back to him?
I would let Michael go. Oh, sorry. Bert.
If no one,
Out of here, Michael.
if no one has any more questions of Michael, I think we can let him go back to work.
Okay.
The tentacles are let go.
Yeah. So that's my proposal, Bert, is that that my motion is that we give $800 for the next 2 months of their to finish their contract, where they do the trial, allotting just that cap of money to go towards cancellation fees for the therapist. And that we see the results before we make a decision for the next year's fiscal contract.
Okay, do I have a second on that motion?
But what? Wait.
Oh,
I just want I mean, we've heard from him, but I'd like to see confirmation of the system in place
Before next year.
no, but I'd like to see, I gotta finish. I'd like to see a confirmation of the policies they have in place, even though he's told us. I'd like to see what they are for cancellation. Is it a text message on the day? He said it is, but I'd like to see how the format of how they do it. Even though he's told us, I'd like to see it on paper.
Okay, I'll ask him to submit us like his cancellation procedure outline for that kind of stuff. I think that's entirely fair.
And I'd like to see how, when they first notify them, do they notify them a week in advance and then the day in advance, like doctors or dentists commonly do? And he may even ask his local dentist, who may have that program on his computer, that where he got it and how much it is and how easy it is to use or hard it is to use.
Okay. So that's my proposal. That's my
Motion?
proposal, my
Motion.
motion, Bert.
Dorothy,
I'm used to being in the other seat, Bert, so come on, bail me out here.
we've got Dorothy's motion. Do we have a second on Dorothy's motion?
second,
John seconded it. Okay, I'll do a roll call. Jill,
Aye.
Rachel,
I don't vote, but thank
Oh.
you.
I guess I'm on the chair now. I'll vote aye. Brooke is gone. John,
aye.
okay, that's it.
No, you didn't ask me.
Oh, Dorothy.
Aye. Bert, can I just make a comment too, now that we've done that?
Yes,
Okay, I will be sending out a letter via Ann on how far I've gotten with my proceedings to discuss with the Interfaith Council, the food pantry. So I'll send out, because I don't have it on the agenda, I'll just send out everybody a letter as to where I stand and what the next step is.
okay.
Okay?
Everyone happy with that?
Yes.
Good.
Okay,
We have, can I turn it back over to you now, Dorothy?
sure.
Okay. The
Thanks,
temporary chair relinquishes his chairmanship.
Thanks, Bert. I'm not sure how that went, but everybody, thank you very much. Jill, John, thanks. Bert, thank you for taking over. Jericho, Rachel, and Ann, thanks again for always being there. Rachel, thanks for being the reasoning. She knows sometimes I need it. And
Great.
everybody, take care of yourselves, okay? I'm gonna can I get an emotion to adjourn?
Motion.
Second.
Second.
Okay, Jill,
Aye.
John,
Aye.
Bert,
Aye.
oh, me, aye. Hey, Bert, thanks a lot. I appreciate it.
Okay.
Thank you, everybody.
Bye, everyone.
Bye.
Dorothy, sorry I was late.
That's okay, John.
Thanks for calling.
You're welcome. You're very welcome. Thanks for coming. It made all the difference. I know you came in and it was pretty confusing, but I
No,
gave
I
up.
caught on.
Okay, good. I gave up because I felt that I couldn't be biased, but I guess I ended up being biased, being non-biased, whatever.
You do a terrific job.
No, thank you. Thanks, John. So you take care. You look great. Can't wait to see you in person.
Bye.